Okay, now we're going to do some additional muscles of the upper extremity. So we're going to do the brachioradialis. The brachioradialis is a good muscle that has some C5 contributions in it, but it is not the axillary nerve or the musculocutaneous nerve, so the brachioradialis is a good alternative C5 muscle. We'll do the extensor carpi radialis longus, which is nearby to it, which is a good C6, C7 muscle as well, especially if the patient has a suspected C6, 7 radiculopathy. We're going to do the flexor digitorum profundus, which is a very good muscle to check if you have suspected, the patient have suspected ulnar nerve injury, because this is the most proximal muscle that is going to be supplied by the ulnar nerve after it crosses the elbow. So that will be, if you have an ulnar nerve injury, that will be one of the first muscles to show abnormalities. And then finally, we'll do the flexor carpi radialis muscle. And this is a muscle that is an alternative to the posterior, I'm sorry, I had it right first time, to the pronator teres muscle that is innervated by median nerve and C6, C7. So if you had a patient with suspected, as your part of your upper extremity screen, the flexor carpi radialis is very good as part of your upper extremity screen, but also if the injury is in the pronator teres, then the flexor carpi radialis would be the first muscle to show abnormalities. So we'll do those 4 muscles now. Okay, so again, my patient is nice and relaxed in a supine position. So for upper extremities, I went back to my 1.5-inch needle because we don't need to use that long of a needle. So I'm going to go. I have my gain set at 100. I'm on brachioradialis. So the motion for brachioradialis is going to be, the location is going to be in between the biceps and the triceps. So there's the biceps and the triceps where we'll be finding the brachioradialis, and it's going to be flexion of the elbow. So you're going to ask the person to bend their elbow, but with their forearm in a neutral position. So they're going to be with their thumbs kind of going up towards the ceiling. Supinated would be biceps brachii, pronated would be brachialis, but in the neutral position, we're going to get the brachioradialis. So we're going to come right in between the biceps and the triceps, and we're going to insert the needle in that direction on the, sorry, get your fingers caught. We're going to insert the needle there onto the inside the brachioradialis. All right, so I take the needle out. I have my electrode set up. My patient's ready, nice and relaxed. Here we go. Feel okay? Turn the sound on. Good, sound is on. If I want to make sure I'm in the muscle, bend your elbow up. Okay, we're not close yet, so I'm going to move the needle a little bit to get into the muscle I want. Okay, bend your elbow up. Okay, now we're in. So now we're in the muscle, so I know that I'm in the right muscle. Just lower the sound just a tiny bit. So I know I'm going to be assessing the correct muscle. So now I do the same thing as I did before. I'm going to insert the needle into 3 different depths, 4 quadrants. 1, 2, relax, relax, good. 3. Those are motor units because they're very regular pattern. There we go, nice and relaxed, good. Extract the needle out. Redirect. 1, 2, 3, good. That's the second depth. Extract the needle out. 1, 2, 3. There's my third depth, a third quadrant. Extract out, redirect. 1, 2, 3. So there's my 3 depths in my 4 quadrants. I waited a second in between each depth to make sure there was no spontaneous potentials. I saw one a little bit there, but it went away, so that was not fibs or positive sharp waves. I can stop the buffer. Now I'll store that live buffer. So I hit F2 to store it. It's stored. I go back to live again. I change my gain to 200. Now I'm going to assess for motor units. So I get them in the neutral position with the thumb in neutral form and neutral. So now very gently try to bend your elbow. Good. So I'm looking for those nice motor units again. There's a few nice ones. I see that they have normal shape, normal amplitude, normal duration. I move the needle a little bit more. I'm seeing a few different more motor units. Normal shape, normal amplitude, normal duration. Now he's going a little bit too hard. There's a little too many on the screen. That's perfect, that's better. There's one motor unit there that's polyphasic, again, but that's not significant enough. If I wanted to stop it, oh, I hit stop twice, but it's still there. I can see that motor unit, so I'm going to stop it and just rewind it, and there's that polyphasic motor unit. So there's that motor unit that's going down, starting here, across the baseline 1, has a turn there, crosses 2, crosses 3, crosses 4, and back to baseline is 4, plus 1 is 5. So again, that's a polyphasic motor unit, but it's not, that's the only one there so far, so that's not significant enough. So bend your elbow again. A little too strong. Good. So we're seeing nice normal motor units there. Normal amplitude, normal shape, normal duration. Extract it out. Redirect it. Bend your elbow up. Good. There's some nice motor units there again. Normal shape, normal amplitude, normal duration. So there was about, let's say for argument's sake, that was 12 motor units, so I can ask the patient to relax. I stop it, I store the buffer file. Now I'll go to, I'll run live again, and I'll go back to 500. Now very gently try to bend your elbow up. And now go a little stronger. And a little more. And a little more. And a little more. A little more. Okay, so we're not getting a good contraction yet, so relax it. I'm going to go to a different area. Try to get a better sense of the motor units. Okay, bend your elbow up. There we go. Go a little stronger. Go a little more. Go a little more. A little more. And relax. Good. And rest. Very good. So now I can stop it and store the live buffer. And there's my 3 for the brachioradialis. Extract the needle out. Got a little touch of blood there, so put the needle back in the sleeve and sheath, and put it there. Feel okay?
Yep.
All right. So that was the brachioradialis. Now I'll go into, since he's in this position here, I'll go to the extensor carpi radialis longus. And that one is going to be with the elbow fully pronated. So that's going to be with the elbow fully pronated, and it's going to be in the same area, but now it's going to be right around, there's the muscle insertion and the origin of the muscle at the lateral epicondyle, and there's going to be the bulk of the muscle right there. So the motion is going to be extension of the wrist. So it's going to be extension of the wrist is where I'm going to feel for that muscle, right over there. I can feel it underneath my thumb. Okay, so there's my finger on the epicondyle, so I'm going to come just dorsal to that. Okay, nice and relaxed, there we go. I'm on extensor carpi radialis, good. Nice and relaxed, here we go. Feel okay?
Yep.
Okay, now you want to make sure you're in the muscle first, so bend your wrist up, take your hand off the table, and right away I'm seeing some nice good contraction there, and relax, good. So I'm in that muscle, so now it's same as before, 3 depths, 4 quadrants. Now this muscle is thin, so I'm not going to have too much of a angle to play with as far as how I'm orienting it. So it's going to be a very small change in angle as I go to my different locations. So there's my first depth, there's depth number 2, there's depth number 3. So that's my first quadrant. Now I extract the needle out, and just a small angle change, and I got my second depth, my second quadrant. There's depth number 1, depth number 2, depth number 3. Extract the needle out, change it very slightly. 1, 2, 3. Now sometimes if you run out of room, If you're not getting it, you may need to extract the needle all the way out, but leave it in the skin and angle it in the other direction. You can angle it in the other direction and get the other ends of the muscle. But I was able to get all the locations I needed by going in this direction. So you could either go in a proximal direction or a distal direction, wherever you can find the bulk of the muscle. So for him, I found it going proximally, but you can just do it as the same and go distally as well. So I'm going to store that buffer. So there's my 3 depths, 4 quadrants. I press stop. I store the live buffer. There we go, buffer stored. Go back to live again and go to 200. Now very gently try to bend your wrist up. Okay, not near the motor unit. So they're not very sharp, they're very dull. So I need to change my angle to pick up the good motor units. Okay, bend your wrist up. There we go. There's a nice good motor unit there. There's one. Put the needle a little deeper, keep going. Good, there's a polyphasic motor unit there. And if I wanted to, well actually, yep, that's polyphasic, it does cross the baseline, so that's a polyphasic motor unit. Again, one out of all these, a lot of them is not abnormal. I put the needle a little deeper, see if it changes. Now we have different shapes. So far we only had 1 out of 4, because there's 3 more motor units there. Those are all normal. So 1 out of 4 polyphasics is not enough to be abnormal. Push the needle in a little deeper. There we go, there's some normal motor units there. Keep pushing up. Good. Get some nice motor units. Those are all normal shape, normal amplitude, normal duration. And relax. Now if I needed to redirect it, if I ran out of room, I can take the needle out, redirect it. Okay, bring your hand up. Almost there. There we go. Now we're getting some nice sharp motor units. Nice sharp motor units there. Very good. Normal amplitude, normal shape, normal duration. All very good. So let's pretend that was 12, so I can have the patient relax. Stop the buffer, store the live buffer. Doing okay?
Yep.
Okay. I press live again. Now I'll go to 500. And again, this should be pretty easy to get good contraction. So very gently push your hand up. Good. And bring it a little stronger. I'm watching to see how those motor units are recruited. And go a little stronger. And go a little more. There we go, getting some nice large ones there. And go a little more. And a little more. And a little more. And a little more. And where baseline is almost obliterated, so very good, and relax. So I press stop and store live buffer. And there are my buffers for my extensor carpi radialis. So I'm going to turn the preamp off. Take the needle out, place it back in the sleeve. Got a little spot there, so put that a little pressure there. So next muscle we'll do is the flexor digitorum profundus. So we're going to go to flexor digitorum profundus. And for flexor digitorum profundus, you can get it in this position, but I'm just a little bit more comfortable having the patient's arm resting at their side. So I'm going to have the patient's arm resting at their side. And now the flexor digitorum profundus, the muscle heads innervated by the ulnar, because remember the FTP is innervated by both the median and the ulnar. The 2 heads of the muscle that are innervated by the ulnar nerve are right next to the shaft of the ulna. So again, there's the epicondyle, there's the ulna, and I'm going to use that shaft of the ulnar as a landmark, and I'm going to place the needle inside next to the shaft of the ulna. So I'm going to leave my finger on the ulna, so I know I'm not going to go into the ulna. I'm going to go next to it, and next to that muscle is going to be the flexor digitorum profundus, the ulnar contributions. So to activate that muscle, you're going to ask the person to bend their IPs of their small and their ring finger. So you're going to ask the person to do that. A lot of times the person will bring all their fingers, but you applying resistance, and this is another way I like this muscle, this position here, is because I can get nice and the patient to be relaxed, and then I can also get them to push down, and I can feel how well that muscle is contracting. So I can feel that muscle underneath my fingers for the FDP. Okay, so I have the patient at rest, so there he goes. I'm going to take the needle, and there's my finger on the shaft of the ulna. I'm going to go right next to the shaft of the ulna. Okay, nice and relaxed. Here we go. And needle's in. Turn it back on, and bend your fingers just a little bit. And right away, I'm nice in that muscle. So I can feel I'm in that muscle. I just had the person contract a little bit, and he got good activation. So I know I'm in the FDP. So now I'm going to do my same technique, my 3 depths, 4 quadrants. Depth number 2, depth number 3. Good, that's 1 location. Extract out, redirect. 1, 2. He's contracting a little bit there. Good. 3. That's my second depth, my second quadrant. Extract out, redirect. 1, 2, 3. Good. Extract out, redirect. 1, 2, 3. So there's my 3 depths and 4 quadrants of the flexor digitorum profundus. So I stop that. I store that live buffer. Buffer stored. Good. Go back to live. Now again, to make sure I'm in the muscle, so just very gently try to squeeze the fingers. Good. Perfect. Hold it like that. Good. A little bit too strong. Just a tiny bit. Perfect. Just like that. Keep holding it. Good. We're seeing nice contraction of the muscle. We're seeing about 3 different motor units on the screen there. So that's very good. We're seeing 3 different motor units there. So now I can just switch my hands. Go to a different depth. Push down again. Good. Looking at that motor units. Those motor units there have a normal shape, normal amplitude, normal duration. Those are perfect textbook motor units. I can come in a little deeper. And that one is polyphasic. So we got 1 polyphasic motor unit there. It's crossing the baseline a few too many times, and you can hear the sound is a little bit different as well. So the sound is a little bit different. But again, 1 out of all these motor units is not significant. I push a little deeper, and now those motor units are normal. So again, 1 polyphasic does not mean the muscle is abnormal. Okay, relax it. I'll extract out and redirect 1 more time. Okay, push a little bit. Okay, not in there yet, so I'm going to go. Okay, I'm out of the muscle, so I'm going to redirect it again. Doing okay? Okay, push your fingers down. Good, perfect. Okay, I'm in that muscle, nice and good. Those are normal motor units. Everything looks good. Okay, relax. Stop the live buffer, store it. Good. Now I'll go back to live again. Now I'll go up to 500. And again, this one should be really relatively easy to get a good contraction of. There's a nice motor unit there. I ask them to contract a little bit stronger, watching the recruitment, seeing if that one particular shape is going on the screen too many times. And it's not. It's nice normal recruitment. I'm activating other different motor units. Keep going. Good. Now go a little stronger. And go a little more. And a little more. And a little more. And this one is pretty easy to get good contraction. Go 1 more time. And relax. Good. Perfect. Take the needle out. Good. So there is the flexor digitorum profundus. Very good. No blood there. I'll store that live buffer. Oh, I deleted it, so I got rid of that one. So, but you got the idea. And then finally, we'll do our last muscle for this arm. So we'll do the flexor carpi radialis. So the flexor carpi radialis, again, we're going to have the patient in with the palm fully supinated, and now you're going to go for about 4 finger breaths distal to the epicondyle. So there's his epicondyle there, and we're going to go 4 finger breaths distal to the epicondyle. And this one, you're going to insert the needle down towards the hand. So you're going to insert the needle down towards this way to get good location, to get good insertion of the muscle. So there's about 4 finger breadths distal to the epicondyle. So I'm going to insert the needle right in there. So I'm going to insert the needle right in there, and I'm angling it downward towards the hand. So I'm angling the needle downward towards the hand to get my flexor carpi radialis muscle. So I'll select on the screen FCR. There we go, back down to 100 on my gain. Okay, so sometimes with the FCR and the coronary arteries, you just have to watch out for blood vessels. So he doesn't have a lot of blood vessels here, so you don't have to watch out for them, but just be aware that this is a little bit more vascularized area, so just be cautious with that. But he's good here, so we're going to insert the needle. Again, about 4 finger breadths right there. Okay, nice and relaxed. Here we go. Feel okay? Okay, turn it on. And if you want to check that you're in, have the patient bend their wrist up. And perfect, we're right in the muscle right away. So we're in the muscle, so I asked him to bend his wrist, so we're in that muscle and relax it there. Now we'll do the same assessment, 3 depths, 4 quadrants. 2, 3, that's first depth, first quadrant. Extract out, redirect. 1, 2, 3, there's my second quadrant. Extract out, redirect. 1, 2, 3, good. Extract out, redirect. 1, 2, 3. So there's my 3 depths, 4 quadrants. Waited a second in between to see if there's any spontaneous potentials. Everything was good. I'll stop it. I'll store that buffer. Buffer stored. Go back to live. Now I'll go up to 200. And again, giving some resistance. And I'm seeing some nice, too much. Just a little tiny bit. Good, perfect, just like that. So I'm giving just a little bit of resistance, and I'm seeing a nice single mode in it. That's perfect. Good, keep going. Okay, there's another polyphasic. Nope, it went away. Keep going. Oh, there it is again. So you hear that sound being a little bit different than the other ones. Again, so we got one normal one there that has a couple of turns, but one abnormal one there that has a couple of phases. So there's one with turns and one with phases. So let's see it, we'll relax it. Let's pause the screen and review that one. Feel okay?
Yep.
All right. So let's go just review that one here so you can see the differences. Okay, there we see the 2. There's this one in the center here. This is the one that has multiple phases, and this one is the one that has multiple turns. So they're pretty good next to each other. This one crosses the baseline multiple times, but this one does not. So this one, if we saw a majority of these, again, more than 30% of them, then that would be abnormal. This one is not significant because it doesn't cross the baseline. So let's go back, let's store that buffer anyway. So let's store that. And then we'll go back to live again. Okay, I'll just move to a different depth. Okay, very gently, bring your, good. Move the mouse thing out of the way. There we go, good. Okay, there's some nice modians there. Those are all normal. Normal amplitude, normal duration, normal shape. Very good. Keep going just like that, hold it, good. Keep going, bend your wrist up, good. Normal amplitude, normal duration, normal shape, very good. So let's pretend that was 12, so let's stop it. Stop that buffer and store it, good. And now I'll go to, I'll make it live again. Now I'll go to 500, and this one's fairly easy to get good contraction. So he's gonna bend his wrist up, good. And go a little more, and a little stronger, a little stronger, a little more, and nice good recruitment there and good interference and relax, good. Stop it, store live buffer, stop screen, and store the buffer. So there we have our flexor carpi radialis. So I extract the needle out, put it back in the sheath, and put a little pressure there. Again, sometimes with these forearm muscles, they can sometimes bleed a little bit, but as long as you put a little pressure there, there's no risk for any serious side effects. Okay, thank you.